How can I tell ringworm apart from other skin problems in pets? Have you noticed some unusual patches on your pet's skin and wondered if it could be ringworm? It can be tricky to tell ringworm apart from other skin issues, so let's break it down. Ringworm is a fungal infection caused by specific fungi, mainly from the Microsporum and Trichophyton genera. It often appears as round, itchy, and scaly patches where hair is missing. These signs can overlap with other skin conditions, making it essential to get an accurate diagnosis. First, let's look at the clinical signs. Ringworm typically shows up as round or irregular patches of hair loss, often with some scaling and redness. You might find these patches on the face, ears, tail, and feet. In cats, a subtle sign to watch for is cigarette ash scaling deep in their coat. However, other skin issues like allergic dermatitis or mite infestations can cause similar symptoms, so just looking at the skin is not enough. Next, veterinarians often use a Woods lamp examination. This involves shining a special ultraviolet light on your pet's coat in a dark room. Some types of ringworm fungi, especially Microsporum canis, will glow a yellow-green color under this light. While a positive result suggests ringworm, it is not a guarantee since not all fungi will fluoresce, and some other substances can cause false positives. A negative test does not rule out ringworm either. Another method veterinarians use is microscopic examination. They may pluck some hairs or take skin scrapings from the affected areas to look at under a microscope. This can reveal fungal spores attached to the hair shafts, which supports a diagnosis of ringworm. This method can provide early evidence but is not as definitive as a culture test. The most accurate way to confirm ringworm is through a fungal culture. In this test, hair and skin samples are sent to a laboratory to grow the fungus. This process can take anywhere from a few days for weeks to get results. This test confirms the presence of ringworm fungi and can even identify the specific species involved. It is especially helpful if other tests do not provide clear answers or if the infection is stubborn. Lastly, veterinarians may perform additional tests to rule out other causes of hair loss and skin lesions. This ensures that the treatment you pursue is targeted correctly. In summary, telling ringworm apart from other skin problems in pets requires careful observation and testing. A combination of clinical signs, Woods lamp examination, microscopic evaluation, and fungal culture helps veterinarians accurately diagnose ringworm and distinguish it from other skin issues. Early and accurate diagnosis is essential for effective treatment and preventing the spread to other animals or humans.